Welcome. I'm so glad you joined me today. As an adult over 65, healthcare is a big deal, and there are so many choices with so many options. It really is overwhelming. Finding an option that is best for you takes some time and patience. I am glad you are considering Impact. Although Impact for seniors is not a perfect fit for everyone, for those who understand how it works, it can add up to great savings. Medicare supplement plans are really competitive. The ads on TV promise a lot of things, but the thing that matters most is your health and your budget. You need to have a snapshot of what it will cost annually, both if you stay healthy and if something changes and you need to use it. So when evaluating Medicare supplement plans, it's important to consider both the monthly premium costs as well as additional costs that may arise when using the plan. Although some plans may offer a $0 monthly premium, they may end up costing more in the long run when you actually need to use the benefits. So let's get into the details a bit. Original Medicare Parts A and B only covers a portion of medical expenses, leaving you to pay the remaining costs out of pocket. This can be especially challenging for those on fixed incomes or with chronic health conditions. This is why most people look for a supplement to assist with the remaining costs. Although Impact isn't insurance and not a Medicare Part C plan, Impact for seniors picks up where Medicare stops. Impact members will share the portion of your eligible medical bills that Medicare allows, but does not pay completely. With sharing secondary to Medicare, this program is an incredible option for seniors. Why? Two big reasons. 1. Visibility and transparency. Impact for seniors members know that the most that they will pay for their health care annually is their monthly share and primary responsibility amount, or PRA. If you need to access health care, you will need to meet your $1,000 PRA. But aside from that, there are no provider fees, no out-of-network fees, no coinsurance. 2. Community. They get to be a part of a community that cares for one another. But let's keep going. There are many different Medicare supplement plans available, each with its own set of benefits and costs. It can be overwhelming for individuals to understand the differences and select the right plan for their needs. Impact is simple, and we are here when you have questions. Will it be difficult to access care? Some Medicare supplement plans may have limited networks of healthcare providers, making it difficult for individuals to access the care they need. Impact members are not restricted to a network. They can see any provider they wish. Worried about the high cost of premiums or deductibles? Some Medicare supplement plans require a monthly premium payment, which can add up over time and can be a burden for those on a fixed income. Or if there isn't a monthly premium, then you have out-of-pocket maximum or maybe a deductible to meet. Each plan is going to be different, so be sure you understand the costs associated. But again, the beauty of Impact is that you only have two costs to consider: your monthly share and your annual PRA. That is pretty simple. No provider fees, no co-share, no pre-existing limitations. One PRA, primary responsibility amount, of $1,000. So is Impact right for you? Are you 65 or older? Have Medicare Parts A and B? Are you excited about being a part of a community of support? Do you want to have visibility into your annual healthcare costs? Finally, are you willing to upload your Medicare bills to Impact? Because Impact is not insurance and not a Medicare plan, Impact senior members need to upload their bills and EOBs to Impact for processing. Impact makes it pretty easy and provides an online center to submit the bills, but this is an added step that not everyone can commit to. So how does it actually work? Well, let's take a look at an example. Carl's wife took him to the emergency room for severe abdominal pain and was admitted to the hospital. He was in the hospital for 3 days and had surgery for a blockage in his lower stomach. Medicare Part A covers the surgery and the hospital stay, but Medicare Part B has a deductible that needs to be met. And this is where Impact will come alongside. All medical bills should first be submitted to Medicare. Medicare will send you a Medicare Summary Notice, MSN for short, or Explanation of Benefits, EOB for short. The MSN is a notice that you are sent in the mail every 3 months. If you sign up with Medicare for an electronic notice, you will get it monthly. You will want to do that and get them monthly to submit to Impact for more timely processing. The MSN will show all your Part A and Part B covered services or supplies billed to Medicare during the period, what Medicare paid, and the maximum amount you may owe the provider. What should you do? 1. Create an online Medicare account at medicare.gov. 2. Once your account is created, you can download your MSN EOBs as often as you'd like. 3. To prevent delays, you should print these monthly and upload them to Impact using the medical expense tool. If you wait for Medicare to send them to Impact, you could be waiting a very long time. Impact cannot process your bills until after Medicare has processed them. Completing a medical expense form requires detailed information. Please provide as much as you can to ensure timely processing. Missing information may delay processing. One of the most important things to include is a CMS 1500 HCFA form or UB4, which you can ask your provider for, so you can submit that together with your MSN or EOB. Medicare should pay their portion of the bill, and once you pay your $1,000 PRA, Impact will share the remaining 20% of all eligible medical bills. Okay, now what about prescriptions? In order for Impact to share in prescription costs, you must have Medicare Part D too. Impact is not just another healthcare provider. We're a community. We're here to support you, to lift you up, and to provide you with the care you need to live your best life.